The 2 years gruesome war on Tigray, which has seen the collapse of the health system in Tigray, was as equal as death sentence, especially for people who live with different chronic illnesses, as they were forced to terminate their medication and follow-ups for more than 2 years. Tigray Health Research Institute, one of the leading research institutions in Ethiopia, has announced the resumption of identifying and measuring the spread of HIV/AIDS in Tigray after 2 years. Vice Manager of Tigray Health Research Institute, Nasreddin Fetoui, says the institution has received a small amount of reagents from the Ethiopian government following the signing of the peace deal.
Following the signing of the peace deal, we've received a small amount of reagents from the Ethiopian government. The amounts of medical supplies we've received now are not enough, as we are expected to examine the viral loads of more than 46,000 HIV patients in Tigray. Currently, we've no idea of the whereabouts of all these patients and their status, as we were forced to terminate our service for more than 2 years. Now we're ready to resume our examination with the little reagents we've at hand.
According to Nasreddin, Tigray Health Research Institute, which was known for its examinations of identifying and measuring the spread of HIV, coronavirus, and rabies, has been forced to limit its services due to lack of medical supplies.
We used it to test 700 to 800 cases of coronavirus, but currently we are forced to terminate this. In addition, we are not testing viral loads, HIV test for children. So if peace is achieved and we could be able to get the budget we need, it is not difficult for us to return back to what we have been doing before the start of the war on Tigray.
Coordinator of Biotechnology at Tigray Health Research Institute, Girma Alamsagid, also calls all concerned bodies to help the institution to fully resume all its services, as it is impossible to cover the demand of the whole Tigray with a current limited amount of reagents.
With the amount of reagents at our hand, we could only provide service in Mekelle and outskirts. So we call all concerned bodies to play their role in alleviating the problems we are facing now.